Control your stress and emotions using one easy technique just discovered by a scientific study. My guest today is Naturopathic Dr. Allison Willette. I'm Bob Garvin. Welcome to Body Talk, episode 102. If you have any questions or comments about this podcast, send an email to lifestarmedia@gmail.com or visit us on Facebook at Body Talk, Bob Garvin. Just want to take a moment to talk about some of the great guests that we have lined up for future episodes. Next time, I'll talk with a thermography expert and learn about the health benefits of this body heat-seeking technology. And cognitive behavior therapy will be the topic in episode 104 as I talk with a psychologist who's an expert in the field. You have the power to lower stress levels and control your emotions, say scientists from Michigan State University and the University of Michigan. The neuroscientists conducted 2 experiments that show that talking to yourself in the third person can help you regain control over emotions during stressful times. For the first experiment, electrodes were hooked up to the study participants' brains while they looked at disturbing images. They were asked to view those images in both the first person and then in the third person. Looking at these images in the third person reduced brain activity involved in emotions in just 1 second, while a first-person response hiked stress levels. This experiment was repeated in a functional MRI machine, and the results were the same. Another example would be if I said, "What am I feeling right now?" my emotional brain response will increase. But if I rephrase that question and put it in the third person and say, "How is Bob feeling right now?" my emotional response will decrease. Researchers say referring to yourself in the third person leads people to think about themselves in the way they think about others, and you can see evidence of this in the brain scans. That helps people gain some psychological distance from their experiences and can help regulate emotions. The scientists summarized it all by saying that talking to oneself in the third person may be a simple and cognitively inexpensive way of reducing negative emotions on the spot. The study was published in the journal Scientific Reports. Now let's turn to my special guest, Naturopathic Dr. Allison Willette. Dr. Willette practices at Good Sense Healthcare in Hadley, Massachusetts. She joins me now on the phone. Dr. Willette, welcome to Body Talk.
Thank you.
You know, a lot of people don't have an understanding about what a naturopathic doctor is. I have people ask me all the time, is it a medical doctor? And how do they differ from regular physicians? What can you tell me about the difference?
I used to describe naturopaths as general practitioners of alternative medicine. But that's not really the case anymore because a lot of naturopaths specialize. So now I've been describing naturopaths as we are parallel to conventional doctors, which are medical doctors, and osteopathic ODs, osteopathic doctors. And our philosophy is slightly different. Our goal is still the same. All doctors want what's best for their patients and their patients to be well. And so it's nice to have, we can be parallel to an MD. We can work alongside with them. We can support in ways that they haven't been educated, just like they can help us in their specialties.
How do you train to become a naturopathic doctor?
So our training is the first 2 years of naturopathic medical school is very similar to that of conventional medical school with all the ologies, the biology, the pharmacology, the pathophysiology, the chemistry, and all that. And then the second 2 years, we specialize a little bit more in learning a little bit about alternative medicines, like we learn a little bit of Ayurvedic, we learn a little bit of Chinese medicine so that we can understand those modalities. And some people go from there to specialize in those. And then also we learn a lot about mechanical chiropractic adjustments are slightly different. So we learn a lot about all forms of medicine and then emphasize more nutrition and preventative medicine.
So can you prescribe medication just as regular medical doctors can?
It depends on the state. Right now, at this time, there's about 18 states that are licensed for naturopathic doctors, but their licenses are slightly different. For example, in Maine, they have a pretty good scope of practice. They can prescribe multiple different things, but not everything. Arizona has a very broad scope of practice for naturopaths that can prescribe multiple things. Some states, like Vermont, which is licensed for naturopaths, if you want to prescribe, you have to take, a very comprehensive test. So it is state by state, which someday, hopefully, will be no more, and then all the states will be similar. But right now, it's state by state.
So when should a person see a naturopathic doctor?
Well, I find that where we are strongest is the things that are a little odd, a little hard to track down, times where it's a really chronic condition and it's just hard to nail down what or why. So oftentimes we will work with inflammatory conditions, chronic conditions. People who've had Lyme for a long time are very sick after they got Lyme disease. Our best skills are working with chronic things that are really hard to test for and medications that can help with symptoms but not treat the cause. And a good example is people who have chronic rashes, asthma, eczema as a child, and they've just always been plagued by being a really allergic person. And we can help with that in many aspects with the approach to diet and supplement use and homeopathy and, depending on what your focus is in the naturopathic realm. I will also have patients who are parallel. They see me and they see their specialist, and we both help them in different ways.
What about other more common things like high blood pressure? If someone was diagnosed with high blood pressure and their medical doctor wants them on medication and they don't want to take it, so they come to see you, could you do something different and maybe offer some help that would not require medication?
Hypertension is a really good example because it kind of sneaks up on you. Oftentimes it's later in life. There's many different causes, but there's some really basic fundamental things that a person can do to really help bring down their blood pressure. A lot of it is going to be weight loss. There's different foods and supplements that are going to be supportive in the sense that it's going to help get rid of it. A lot of times it's what's causing it. Is it stress? Is it lack of sleep? And hypertension oftentimes comes along with a number of other conditions. And so we, naturopaths, we talk a lot about treating the cause and taking a step back and looking at the whole person, which is why our appointment times are longer than a conventional doc, and why we will treat multiple things at once. If a person has high blood pressure, would a naturopath be helpful? Absolutely. Preventative care is, I think, probably one of the biggest parts about why I left conventional medicine to study naturopathic medicine, because to me, it makes the most sense to do preventative care. And it's, at the end of the day, that's going to be more cost effective for the nation as well as for the average bear.
What type of support can you offer for people with allergies?
So there's a lot of support that we can do on, we'll say, okay, when your allergy season is coming up, you have your Allegra or whatever. Let's also add to it, this herbal protocol. Or let's look at what else is causing you to be inflamed besides whatever's in the air. Maybe there's something that you're eating that your body doesn't like that is just making you more inflamed. A lot of what I do is I work with people on the fundamentals, and it helps a lot with allergies. By that, I mean, the example I give is everybody's given a bucket when they're born. And the bucket has holes in it. You can think of it as like a colander. And those holes are the body's systems of getting rid of waste. These are the organs of eliminations, or the old-fashioned word is emunctories. And they are the skin, the lungs, the colon, and the kidney primarily. The liver's involved in all of them, of course. So then what I work on is let's get all those organs of elimination working properly, so that you're getting rid of what you're supposed to be getting rid of. And that can take several months. Let's make sure you have a bowel movement every day. Let's make sure that you're exhaling, because when you exhale, you're exhaling waste. Let's make sure that you're sweating because your skin is a big part of detox. And then, the kidneys. Are you drinking enough water? Are you drinking water? So that's where we start. And when you start getting those going and working properly, a lot of people's symptoms kind of shift a little bit and not so bad. And now maybe the medicine that they're taking works a lot better. Maybe they don't need to take as much. Maybe the steroid nose spray, they can get rid of it. Maybe they do a neti pot instead. So a lot of what naturopaths do is working with the fundamentals.
Dr. Willette, thank you so much for joining me today on Body Talk.
Yeah, absolutely. My pleasure.
Well, that's it for this edition of Body Talk. My producer is Katie Stell. The Body Talk theme song was composed by Rob Carlson and sung by Vicky Vox. If you'd like to stay up with medical studies on a daily basis, follow me on Twitter at BGPVideo. And if you have any questions or comments about this program, feel free to send me an email at lifestarmedia@gmail.com. Body Talk is a production of Lifestar Media.